Hi, I'm Chris Cinnamon with Chicago Tai Chi, www.chicagotaichi.org. And I'd like to talk to you briefly today about knee osteoarthritis, what we call knee OA. Specifically, I'd like to talk to you about knee OA and Tai Chi, and some exciting developments in medical research for knee OA sufferers. Plus, in just a few minutes, I will show you two simple techniques from Tai Chi that you can begin to practice today. And if you practice them, they may very well help your knees. Now, if you're a knee OA sufferer, I know how you feel. I have knee OA diagnoses in both knees. The primary symptom of knee OA is pain. It hurts. It hurts to go upstairs. It hurts to go downstairs. It hurts to get up out of a chair. It hurts to sit in a chair. Over time, that pain can lead to reduced mobility, reduced function, deterioration inside the joint. The primary treatments are medication for the pain and ultimately joint replacement surgery. No fun. 10 years ago, that was my trajectory. Chronic pain, lots of ibuprofen, all of that was beginning to limit my activity. I was looking ahead toward joint replacement surgery and a lot of ongoing discomfort. Today, it's a different story. Instead of sore, achy, stiff knees, my knees feel strong, springy, and generally pain-free. That's not how it usually goes with knee OA. I attribute that progress in my case to a lot of Tai Chi and related practices. These practices have helped strengthen my knees, regain function, and almost eliminate chronic pain. I know Tai Chi has done that for my knees because I have felt clearly what's going on inside my knees through years of practice. But that's just my experience. From that experience, I cannot claim scientific proof that Tai Chi helps knee osteoarthritis. But what I can do is point to at least 7 studies in the last 8 years evaluating Tai Chi practice in knee OA patients. Each of those studies concluded that Tai Chi practice led to significant improvement in pain in knee OA sufferers. Several of the studies concluded that in addition to improvement in pain, Tai Chi practice resulted in significant improvement in function and mobility. So that leads us to a question. Doesn't learning Tai Chi sound much more appealing than more medicine, more pain, and more surgery? I know the answer for me is definitely yes, and I hope it is for you. At Chicago Tai Chi, we work with many older adults with knee OA, and we help them. To help other knee OA sufferers, we are developing an online course, Tai Chi for knee OA. We expect to have that out shortly, and we'll keep you posted on that. In the meantime, I want to share with you 2 simple Tai Chi techniques that focus on the knees. You can begin practicing these today. And if you continue to practice these, they may very well help your knees, as I know they helped mine. So, let's get up and begin. So the first of our 2 exercises involves increasing our ability to feel inside the knee. If you have knee osteoarthritis, usually what you use to feel inside your knee is pain, and what we're trying to do is feel other sensations inside our knee. So first we want to stand a particular way. We want to get our feet roughly underneath our hips. Rather than having a wide brace stance like this, which can put pressure on the inside of the knee, we want to stand in a way so that the feet are right under the hips. And then we want to have our knees a little bit flexed, a little bit soft, not locked. We just want them soft. And then I want to do a little exercise to help you get your mind out of your head and into your body. So, and this will involve feeling the feet. So feel your feet. And then with as small a movement of your pelvis as you can, put a little pressure on the balls of your feet, just a little. Now with a little movement of the pelvis, put a little pressure on the heels of your feet. Back to the balls of your feet. Back to the heels of your feet. To one side of the feet. To the other. Back to the heels. Back to the balls. And now adjust your pelvis and your legs so that the pressure on the bottom of your feet is even between the balls and the heels, and even between the sides, and to spread out reasonably evenly over the arch. So adjust yourself and feel for an evenness of pressure in your feet. All right, now we're going to come up to the knees. Feel inside your knees to the extent you can. And now with a small movement of your pelvis, put a little pressure in the front of your knees, just a little. Now to the side of your knees. Move that pressure to the back of your knees. Move that pressure to the side. Move that pressure to the front. To the side, to the back, to the front. Now we're not using a lot of force. We're not using force at all. We're just adjusting our pelvis in small ways to move the pressure around inside our knees and feel the difference in pressure. Front, side, back, side, front. Now, adjust your pelvis, adjust your legs so that you make that pressure as even as you can spread out inside the knee joint. And just take a moment and feel for an even pressure. When you get that, note it. We'll call that your sweet spot. Your sweet spot in your knee is when the pressure is relatively even across all the surfaces inside the knee. And as a practice, you want to now start becoming more aware of your sweet spot and spending more time there, rather than in ways that may put pressure on one side of the knee more than the other. Because, I mean, the inside of a healthy knee can take that differential pressure, not a problem. But when you add the degradation of cartilage that is involved in knee OA in certain parts of the knee, pressure on one side of the knee where that cartilage is deteriorated can aggravate and irritate and increase the degradation of that cartilage. We don't want to do that. We want to spend more time with the pressure even. And in the online course, we'll talk a little bit more about what's going on inside the knee when that pressure is even. But for our purposes, we just want to get used to our sweet spot and start spending more time there. So that's the first practice you can start doing today. Find your sweet spot. Get the pressure even in your knee joints and start spending more time there. So now the next practice involves a movement component that is common throughout all Tai Chi styles and throughout all Tai Chi forms, and that is the smooth, deliberate, controlled weight shift. All right? So to do that, we're going to put one leg forward, and we'll take just a small stance here. Put our hands on our belly, and now shift the weight back. And as you shift the weight back, get to a place where you are reasonably comfortable, where you're not experiencing any significant pain in the knee joint. If you shift the weight back and you go, ow, that's shifting the weight too far. So move the weight forward until you get to a place where you can put weight on the back leg in a way that doesn't cause pain in the knee joint. And then pushing from the back leg, shift your weight forward. And again, if you shift your weight forward and ow, you're feeling pain in the front of the knee, that's too far. You want to shift the weight forward to where you can comfortably put some additional weight on the front leg with no pain in the knee or minimal pain, and then that's it. And then there you've established the range of motion where you can comfortably, reasonably comfortably, shift weight back and forth. Forward and back. And to shift weight, we push with the back leg, putting weight on the front, and then we push with the front leg, putting weight on the back. Now, maybe your knees feel fine, and you can shift 100% of your weight to the front and 100% of your weight to the back. All right? But maybe you can't. And for a lot of us with knee osteoarthritis, we can't do that comfortably, at least until you've done a lot of Tai Chi. So you just want to shift a little bit. If you can shift more comfortably, you can shift more. But you don't push this. Tai Chi does not heal you by doing Tai Chi into ranges of motion that hurt you. So, you'll do that on one side, and then you'll do that on the other. And the range of motion may be different between the sides depending on the condition of your knees. So as a practice, you want to start that, do a set of 10 or 20. And then over time, if you can do that comfortably, you could do 30, 40, or 10, 15 minutes of this gradual loading of the knee joint, unloading of the knee joint in a way that does not aggravate or cause pain. And if that's all you do, if you spend more time on your sweet spot, if you practice gradual, controlled weight shifting that does not cause pain, you will begin to incorporate a few of the elements of Tai Chi that can be immensely beneficial for knees with OA. All right, I thank you for your attention. Keep in touch with us via our email list, or we're on Facebook at Chicago Tai Chi or Twitter at Chicago Tai Chi, and we'll keep in touch with you about our online Tai Chi for knee osteoarthritis patients and other online products we have. Thanks. Good day.